Good evening. I would like to respectfully acknowledge that I am joining you from Chief Dry Geese Territory, which is in Yellowknife, the traditional land of the Yellowknives Dene First Nation. However, this webinar is hosted from the Institute of Healthy Living and Chronic Disease Prevention, which is situated on the traditional, ancestral, unceded territory of the Silks Okanagan Nation. I would also like to acknowledge that attendees are joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of those lands. I am Jennifer Jacoby, Director of the Institute for Healthy Living and Chronic Disease Prevention, and I am thrilled to have a co-host today, Michelle Smith, the lead for Learning Health Systems at Interior Health. Welcome to the 12th Okanagan Embrace Aging Month, and thank you for joining us this evening. Embrace Aging is co-hosted by Beem Credit Union, Interior Health, and the Institute for Healthy Living and Chronic Disease Prevention at UBC Okanagan. Embrace Aging Month was launched, believe it or not, 12 years ago. I'm so impressed. To celebrate and raise awareness about positive aging, we are proud to assemble and host an array of educational opportunities, tonight being one of them, and events during the month of March. The sessions and events are designed for everyone, young and old alike, and focus on a variety of topics related to healthy aging and ways to improve the quality of life for older adults, their family, and caregivers. Our goal is to inspire everyone to embrace positive aging. Now, before we get underway, there's a few organizational comments that I need to make. Closed captioning. To turn off closed captioning, if you go to the hide caption button on the menu bar, the closed captioning will disappear. Tonight, we're going to have a question and answer period at the end. If you have questions during the presentation, please type them into the chat box, and Michelle will read them after the presentation. We'll go about answering them through a Q&A session at the very end. Now, following this event, you will get a survey for feedback. We encourage you, please fill out that survey. It's not only about tonight's events, but it's about Embrace Aging, as well as other events that the Institute hosts throughout the year, and we'd really value your feedback. Now, with all the beginning introductions, I am finally pleased to welcome Dan Levitt, Senior Advocate of the Office of the Seniors Advocate in the province of BC. Dan, we're going to turn it over to you. Thank you very much.
Well, thank you very much. And it is really indeed an honor to be here and talk about something that is near and dear to all of our hearts, and that's aging. And it's something that every day when you wake up, you're a day older, and our population is getting older, and that's good news. And we should be embracing that as an opportunity. We've known about the aging demographic for a long time. And what we're talking about today is investments that are needed to bolster and support the aging demographic. And hopefully there'll be a little bit of inspiration towards the end, because some of the stuff is pretty heavy and some difficult conversations that British Columbians are having right now around prioritizing the needs of older people. I want to take you on a journey back to the early 90s and join me in the classroom I was in at UBC, where I took my undergraduate degree. It was in arts, but specifically a major in psychology. And in my calendar, there was a course that just fitted. It was an elective called The Psychology of Aging. I had no idea what kind of impact that course would have on the rest of my life. But back then, the professor would be standing in front of the classroom and had one of those projectors that you slid the cellophane, the plastic sheet on top, and an image of two seniors with a plant, kind of like this one we're seeing today, appeared in front of us. And to the amazement of the students, including myself in the classroom, the professor went on to describe this study that was done in 1976. That's a long time ago now. Back then, it wasn't that much earlier than when our class was being taught in terms of timelines. But these two social psychologists went to a nursing home in New England. And in that nursing home, they gave all the residents who lived there a plant, just like the one in the picture. And the first floor of the nursing home, they went to those residents, which were the experimental group, and they said to those residents, "We're giving you a plant. It's yours. but you have the responsibility to make sure it gets watered, that it sees sunlight, and that you fertilize it, and that you take care of it so it grows. Any questions? They left that floor and then went to the second floor. And we're assuming these two groups of seniors are homogeneous, meaning that there wasn't more dementia on one floor than the other or more chronic conditions on one floor than the other. The people generally, as we would say today, had similar inter-rise scores in terms of the case mix. So they went to the second floor and they gave that plant to the residents and each resident, and they said to those residents, this plant's yours. However, the staff will take care of it. Any questions? They called that the control group. The researchers left, came back sometime later, and they went to that second floor. And those residents, as you might expect, nothing really changed in their course of trajectory for their conditions they have. Some of them had more decubitus ulcers, those bed sores, or just even redness on their skin from spending too much time not engaged in the world around them. Some of them had lost weight, which was not the plan, or doesn't have to be the plan. Some of them had tried to leave their floor and get out of the building because they weren't engaged. They were on more of those chemical restraints, the psychotropic medications that antipsychotics that we unfortunately prescribe too much in care homes. They had more than their share, and one of those residents had died as well. Then the researchers went to the first floor and they checked in on those residents, and the opposite had happened. Those residents were more mobile. They had gained weight. They were eating more, and they weren't trying to leave the building. And none of them had passed away, and they were more engaged in the world around them. So the very simple intervention of having responsibility made a difference. This idea that if you live in a care home, just about everything that happens in the day is done for you, and you have very little control over the world around you compared to something that when you wake up, it's dependent on you. It makes a world of difference. It gives you self-efficacy and certainly gives you self-esteem that if you don't wake up, if you don't do something, something bad will happen to something else. So when I heard that story, this was by Ellen Langer and Judith Roden. The research is still available online. And why I'm telling you that story is because the narrative that you might hear about the care homes doesn't have to be that way. Just like the narrative about growing old doesn't have to be the way we're used to. So I would suggest that one way we could think about aging and about our own future, just perhaps anyone here who's working with older people, or knows older people in your personal life, that what if everything that you knew about aging was wrong? What if we could reinvent what the nursing home is, and that they appear to be not home-like, but homey, and that they're built to a residential home or condo standard, not to a hospital standard? What if the world around us really embraced aging and no one had to hide and essentially lie about their age? So that's kind of what I wanted to put out there as kind of a starting point for maybe our philosophy with where this could go. So I'll go to the next slide and talk about the situation in British Columbia currently. The population, as we know in British Columbia, is growing and it's also aging. That's good news. People are living longer. That's good news, especially if you're aging every day. So over 65-year-olds in British Columbia, there's more than 1.1 million seniors today in British Columbia. I need to update this chart. However, in 11 years from now, by 2036, that number will increase to 1.5 million. That means that today there's 1 in 5 British Columbians. In 11 years, there'll be 1 in 4. 25% of British Columbians will be a senior. The oldest baby boomer today is in their late 80s. Excuse me, their late 70s. They're septuagenarians. By 2036, the first baby boomer will become a nonagenarian, somebody in their 90s. And why is that important? Because we know that as you age, you are more likely to need more complex healthcare services, and you'll be less independent as a percentage of the population. And that really impacts more people at the age of 85. That's really the critical number here. So 12% currently of all seniors are over 85, and then 17% a 5% increase in the next 11 years. Here's some myth busters that I want to talk about. There's a myth that if you're a senior, you're dependent on others. Well, that's not true. In fact, only 5% of the population over 65 are dependent. So 95% of seniors live independently, and they're doing quite well. Thank you very much. It does change at 85. A quarter, essentially, 23% of seniors are dependent, but still, 3 out of 4 seniors over 85, 77%, are independent. When you get to 85, where do they go? Well, it turns out that 9% of all seniors over 85 are in assisted living. And we haven't built as many assisted living units as I believe are needed. So that number could be even higher. 13% of seniors over 85 are living in long-term care. Excuse me, the stat that's missing there is that 11% of seniors are receiving home care, home support services. So essentially, 1 out of 3 seniors is receiving care, either at home or living somewhere receiving care. The other third of seniors over 85, usually the spouse, are caring for that person who's receiving care. You're wondering about the other third? Well, those ones are the ones who are dancing and romancing and wish the music would never stop. I think our collective challenge today is, how do we support the caregivers? How do we support the people receiving care so that they become the lucky ones? Another myth is that all seniors are wealthy and they can kind of have a disproportionate amount of resources to spend. In some cases, it's true that seniors are wealthy, but the median income in British Columbia for people over 65 is $34,000 a year. That's the median. That's the midpoint. And 25% of seniors are living on $23,000 a year. So, and some of them are owning a home. So 80%, 4 to 5 seniors own their own home. And our office has been making sure there's awareness out there around the ability to defer your property tax, which is certainly a good option if you're house rich and cash poor. And seniors, from my point of view, shouldn't be forced to sell their home to bring that equity into their pocketbook, or nor should they have to maybe make way for others. It's their home; they have the right to enjoy it. 1 out of 5 seniors, however, are renting, and they're the ones we're really concerned about, because the low-income seniors renting, we know how much rents have gone up in the past number of years, and it's hard to think about the Safer program without talking about Safer program. It was improved on Tuesday in the provincial budget. Both the number of people who are covered was increased, and the rent threshold was raised above $1,000, and the subsidy, I believe, is around $400 now instead of the maximum being $300. So something like 30% more people will be, the increase, I believe, is 30% more money is available for seniors. However, the goal of the program is that seniors are only spending 30% of their income on rent. So to the extent that we're hitting that target, which we'll monitor, you could measure the success of the program. And by the way, last year, there were 14,000 British Columbians that were waiting for an affordable housing spot, and only 6% of those 14,000 people actually got a space. So we definitely have to build more affordable housing in our province. On the top right, 14% of British Columbians are employed over 65, some because they need to be employed because of affordability, some because they enjoy their work, maybe some because of both. An interesting thing that we've learned recently is that people at 65 lose benefits. Some of them in some employment groups do no longer get long-term disability. They don't get group life, and they don't get accidental death benefits. So, and that's only because of their age. At 65, they lose benefits. Excuse me. In their early 70s, they lose the ability to contribute to a public pension. Excuse me. And that's also concerning. 80% of, you know what I'm going to do? If you can bear with me for 1 minute, I'm just going to run and grab a glass of water. I'll be right back. A note for all presenters here: always make sure you have water available to quench your thirst. So, um, so that is concerned certainly on the benefits, and our office is looking into that. And I believe it includes, and I am double checking this, but I believe it includes workers like the people who deliver your mail. I believe it includes teachers, paramedics, nurses, and also um, the municipal employees like firefighters and if you have a local police department. 41% of seniors are volunteers, and without people volunteering over 65, I think the whole social safety net wouldn't work. So it's so critical that we look at how seniors are spending their time, those who want to be engaged in work and volunteerism. 80% of seniors continue to drive. And there's something that we're looking at, which is the requirement of older drivers. These are people over the age of 80 having to go to the doctor in order to continue to drive. And we're all about road safety. However, they're forced to go to their doctor for this test. Some have reported not feeling like it's a test that a person really should be having. It's a little demeaning, if you will. They feel a little childish doing this test. But what they really have concerns about, it, and as do I, is the cost of that test. It's not covered by the medical services plan. And some doctors, like mine, charge my dad, I think $30 approximately. I've heard from some seniors who have paid almost $300 for this test. So it's really important that seniors are able to continue to drive so they can maintain their independence and not be isolated and forced to essentially be socially excluded because they can't access the programs and services in the community where they used to spend time. And we also are certainly monitoring, by the way, um, around the road safety piece. My dad's 88. His granddaughter is 19. My daughter, and you can guess, and the younger one did not have to have one of those tests done. And you can guess which one in the past year had a car accident. 20% of seniors are using transit or some other form of transportation, but usually transit. And Handy Dart is something that we've looked at. It was good to see some Handy Dart improvements in the provincial budget announced on Tuesday. We certainly applaud that. We want to see how that rolls out. But really, the important thing is, and I just found this out recently, that TransLink, BC Transit, they are responsible actually for not just the accessible transit system, which is very accessible, but actually making sure that from the front door to where the bus stop is accessible, so that the sidewalks are easy for seniors to navigate. The last one I want to talk about also on the bottom right is dementia. Is that, again, there's this myth that seniors have dementia. Well, 5% of all seniors are yes, they are diagnosed with dementia, but the vast majority, 95%, do not have dementia. And when I talk to seniors group, I mentioned some of the things that we might forget about in our short-term memory, and some of you may have some of these experiences also, as I do, that you might not remember what you had for lunch yesterday, but it might not matter. If you can't find your keys, it's usually because you didn't put your keys in the spot where you usually put them. Now, if when you lose your keys and you find them and you're looking at your keys and you're thinking, I don't know what these are, then you have a problem. That's dementia. Losing something or forgetting something shouldn't be concern. And certainly, our brains only have so much gray matter, and at a certain time in your life, that gray matter is full. And we should be kind of easy on ourselves and find ways of trying to remember things that we think are important. Oops. Let's go. So current challenges, biggest thing we hear about from seniors when I speak to seniors around the province or when they call us are issues around income and affordability. There just isn't enough affordable housing for seniors. The public funded home support system is expensive. If you're earning $30,000 a year, living on $30,000 a year, you're going to pay $9,000 a year for 1 hour of home support. So seniors are making the choice to move into long-term care prematurely because of the affordability challenge. So that 30,000 a year earner is now at $21,000 a year, and now they're below the 25th percentile of all seniors in terms of income. And we know there's a huge wait list right now for long-term care and assisted living. The long-term care numbers have gone up, I believe, 150% in the past 5 years. A year ago, there were 6,500 people waiting for long-term care. So if we opened 6,500 beds today in the right locations, there'd be no waiting list. But if we started building those beds today, it's going to take 3 to 5 years to get them open, and by that time, we're going to need probably some other number bigger than 6,500. And the assisted living program, very successful, but not enough. So here's recommendations we made last June to the government, and I'm pleased that 2 out of these recommendations have actually been accepted. The first one, providing immediate financial relief for low-income renters. The SAFER program has been increased twice in the past year, so we're grateful to see that. And again, we want to see that continue. The BC Senior Supplement, which is for the lowest earning incomes of seniors, and these are when I say incomes, I'm talking about OAS, and these are GIS recipients. It was doubled recently, in the past. When I say recently, past number of years, from about $50 to $99. Not everyone gets the maximum amount, and we want to see that at least in indexed to inflation. The home support piece I mentioned, apparently last year that came very close to being approved in the budget, but got pulled at the last minute, as did the next one, the shingles vaccine, which is critically important. I was really optimistic it would be put in the budget, but I think with everything else going on, it was an easy one not to add on. But just like there's a suite of vaccinations for children, there should be a suite of vaccinations for older adults. Shingles, pneumococcal, COVID, RSV, and influenza. And the last one, we're beginning to plan for this. The ministry has invited me. I asked the premier and spoke to him this week about this as well, and he has delegated it to the Minister of Health, who delegated it to the Parliamentary Secretary for Seniors and Long-Term Care, Susie Chant. And we are looking at a cross-ministerial strategy, so involving housing and transportation and health and other ministries like social development, to come together with a seniors plan with key deliverables and targets. We haven't seen that, and certainly that would make a big difference for seniors. So I want to kind of move towards a different topic and then have time for a discussion, questions, and answers. I think it's really important that as we go forward in this movement of embracing aging, that we reimagine our own aging journey and even challenge your own perceptions of growing old, and even valuing seniors. So the next slide in the presentation was a picture of the Rolling Stones, of Ronnie Woods, who's almost 80. He's a lung cancer survivor, missing part of a lung. Then you have next to him in the middle is Mick Jagger, and Mick's 80. He's had cardiovascular surgery and challenges. And then next to him, I say Keith Richards, and usually somebody in the audience, when I'm doing this in person, will yell out, "What's keeping him alive? God only knows." And the point of showing the Rolling Stones is that, yeah, sure, not everyone gets to enjoy life the way that they've been privileged to enjoy life, but they're good examples of people in now octogenarians who are enjoying life to the fullest. And no one's saying they're too old to do their job. Sure, they're not exactly the same way they were when they were on the Ed Sullivan Show in the 60s. However, when they came here in July for the concert, it was sold out. My sister and I were in the back of the floor in the cheap seats. We had a tough time standing all night long. Meanwhile, Mick's on the stage doing his thing as Mick does, running around the stage, skipping, dancing. He hits the low notes, he hits the high notes, and he blew the roof of the stadium off that night. And they just completed that world tour, a world stadium tour, and recently won best rock and roll album for the Grammys. Probably for how many times have they won that award? They're doing this in their 80s now. So I would suggest that not everyone ages the same way. One of their great songs is "Gimme Shelter," and as much as I enjoyed the music, that song, I started listening to the lyrics, and the lyrics really are appropriate for tonight. It starts off by saying, "Yes, a storm is threatening." What's the storm? Some people might call it the silver tsunami. Well, yes, we like silver. Silver is good. We should celebrate silver. But a tsunami is unpredictable. But we've known about this for a long time. And then we think about a tsunami being violent. And I don't think seniors are violent. So it's really a rising tide, or maybe a silver wave, you might call it. And then, so a storm is threatening my very life today, my very life. So our existence. If we don't do something, we won't enjoy the same quality of life that we have today. And then the next part is, if I don't get some shelter, well, we need to build more affordable housing. We need to build more long-term care, more assisted living. And then the last part of this song, or the first paragraph, the first stanza, I guess, says, Lord, I'm going to fade away. Social isolation or social exclusion, however you look at it, loneliness, and not being able to access the world around you. So that's really the inspiration piece. I have some more to share if you like, around just rethinking aging and combating ageism. But I'd love to hear from you. I think we have some time now for some Q&A, and looking forward to hearing from the audience.
Thank you so much, Dan. We do have some questions starting in the chat, and if anyone else, please add in. So our first one is from Anna. I believe that the BC Association of Kinesiologists would greatly be able to assist the aging population in BC to live more active and autonomously if they had the backing and supports to regulate in our province. 60% of patients are 65 plus, my eldest being 102. Working with seniors brings us so much joy. The main thing I work on right now is orthopedics, motor control, proprioception, am I saying that right? For preventing falls and joy finding aging while living with a chronic condition. Thoughts on this, Dan?
Well, I think kinesiology is a very important profession. And when you start thinking about what you do, and you start thinking of other allied health professions, we need more. We certainly need more. For people who are living in the community, it's really important that you can access primary care. So primary care traditionally has been a physician, and we've started to be more open-minded about who can do the work. We now have nurse practitioners, we have physician assistants. By the way, these professions, if you only have the word physician assistant, or the term recently, it's been around since probably the early 90s was when I first heard that term. Physician assistants, physiotherapists, OTs, kinesiologists, dietitians, dental hygienists. There are social workers. Actually, the social worker is one of those positions that can really navigate and help. A quick example about being open-minded to other professions. I was recently able to do some research about some innovation in acute care in Toronto, in the downtown hospitals. They're doing some wonderful things. They're starting an emergency department that fast tracks seniors through with a social worker. A social worker you probably wouldn't expect necessarily to see right away, a geriatric trained social worker. And then also a social worker was helping with in homelessness or homelessness prevention for at-risk seniors. So I think we to be pointed to your concern, kinesiologists and others should be part of our healthcare system. We need to have a more robust viewpoint of this so that we can start filling some of those vacancies. And it's good, I think, it's good news that pharmacists have expanded scopes so that they can do things that traditionally pharmacists couldn't do, and only a doctor could do. And we're short doctors, why not use other professions to help out?
Thank you. And with the seniors plan from Dave, would the seniors plan on housing, transportation, health needs be the same in rural regions as well as urban areas? Or would there be a more location tailored plan for rural versus urban?
It's a good question. I believe 13% of the population of BC lives in rural BC, and I think rural BC is defined as communities with less than 10,000 people. We need a special plan for rural areas, and I visited some. I went as far north on Vancouver Island as Port Hardy because I really want to understand what it's like to drive a couple hours down to Campbell River to get healthcare. Because it's one, if you've never done it, I've never done it until recently. It's a forest the whole way, and I can't imagine what it's like, the stress if you're having to rush to a hospital and then you get to Campbell River and maybe it's the emergency room's closed. You're going to go down to Comox or Courtney. So yes, we need a different plan. We need to think about, this is where it all comes in. Transportation. How do you go from Port Hardy down there, or how do you go from Fernie to Cranbrook, or from Chetwynd to Prince George? We got to make sure we get that piece right. And then when we get to those urban centers, that we can provide the care we need. And I hear about things like eye examinations. You go see ophthalmologist specialist who's only there so many days in a month, and then you can't drive home, so you need transportation after getting your eyes dilated. So we need to really think this. One thing I'll just point out that I'm really excited about is in our long-term care report. Here's a spoiler alert. In our long-term care report that we're going to release in the spring, it hasn't been written yet, but if I get my way, I should get my way in the seniors advocate, but I don't always get my way in the office. It doesn't always work that way, unfortunately. But I really want to see a rural-made, local long-term care solution. So, an example: Chase. Had a conversation with them earlier this week, and 2,500 people live there approximately. Um, they might say 50% of them are seniors. The average is 20% of the province. Somewhere in the middle is probably the right number. Maybe it is 50%. Maybe somebody on this call tonight was at that meeting with me. But anyway, we could build a smaller household kind of model that has the building standards. I'm gonna be controversial here. The building standards of a house or a condo, not of a hospital. Somewhere near the assisted living building that exists there. Look at other services, like they have an adult day program there and home support. Put those services, wrap them all together in terms of one umbrella managing that. And why not have some long-term care beds there in a hospice, so you don't have to drive. I think it's 38 minutes to Kamloops, half an hour to Salmon Arm, and I can't remember how far Vernon is south. And I think Chase kind of serves all the Shuswap. So yes, we have to tailor make our seniors plan for rural BC.
I think if anyone has questions about that, Dan, they should do those drives, because I do them with my role, and I've been on those roads, and that's a long way to expect people to drive across from to get to everything back and forth. So definitely. The next one is from Ashley. In what ways is the province helping seniors build stronger networks of support and community engagement to combat loneliness and isolation?
Yeah, thanks for that question. I'd love to be able to say I have some examples and start listing them off. I've heard lots of them, and I think again, if you're in rural BC, it's certainly a different story. But there are lots of programs going on. If you're, I know we're talking about the Okanagan today. I'm thinking of senior centers. If you're near a senior center, I visited some that have a very robust amount of services, and seniors are very engaged there. But Meals on Wheels is one of those programs that I always like to think about, where it's community based. Often a nonprofit runs it. Sometimes there's some funding available. The senior pays a nominal amount of money. The meal comes in. Usually, the senior will make that meal last, for 2 meals or 2 sittings. And when the volunteer driver goes in, they're saying hello. So it's a social relationship there. But they're also checking out the apartment, making sure they're not hoarding or that things haven't changed. I would like to see more of this. As a side note, I'd mentioned I was a big fan of Dr. Ruth, of how she lived her life, and talked about things that most of us don't really feel comfortable talking about publicly. But what I was most admired her is her last job. I don't know if everyone knows this, but her last job before she passed away, I think she did this for a number of years, was she was living in New York, and she was appointed by the governor of New York to combat loneliness. She was like the czar or the chief person to combat loneliness. And I'm not sure what she achieved doing this, but I certainly admired her. I had a chance to interview her. You can look up Dr. Ruth and Dan Levitt. You'll see the interview I did in the Vancouver Sun. But sure, we need to do a lot more to combat loneliness for seniors.
Thank you. And our next question is from Sandra. It's great for renters to get assistance, but I'm a homeowner and I've downsized. So now I have a small mortgage payment, but I'm single, and in my CPP, OAS, and GIS is only $2,000 a month or $24,000 a year, with the increased costs of house insurance, taxes, maintenance, utilities, along with groceries and health costs. I thought I did the right thing by buying my own home, but it's so tough to get by.
Yeah, and that's the challenge, because the property tax deferral is only available for people who don't have a mortgage. So you don't have that option. And then I don't even think you're eligible for a home equity loan, which I'm not a fan of. People who do them and promote them and work in the industry are always trying to get me to want to endorse it. I don't really understand them, why they're so good for seniors, because I think you're paying more than you have to in terms of getting that benefit. So I would love to, maybe if you want to contact our office, I'd love to have another conversation with you to understand what some of the options are. But I do think you're in a very challenging predicament there, and that's a tough situation you're in.
And we could put the link in the chat too as well if it,
Sure, please.
before
And
we leave.
the only thing I might suggest, and not something I would want to do myself, but is I have a great aunt who lives in Vancouver in a house that's way bigger than she needs. And even before she's now towards the end of her life and getting home care in her house, but she's always had a person living in the house with her. She didn't need the money, but in your case, maybe you need the money. But she had somebody who was doing kind of that co-housing option. And I think the general idea, it also helps with loneliness, but generally the idea is you have these empty spaces, other people can live there, and you're helping out each other get by, if you will. Somebody might have the money they can bring to the table. Somebody else might be a cooker, and they can make the food and do some housekeeping. So everyone kind of helps out a little bit. Maybe someone else can do the gardening. I love that idea.
And that's, I think, Happy Pad is that the name of that one? Happy Pad?
I've heard Happy Pads, and the one but my favorite one, I don't know a lot about it. Maybe somebody else does on this call. They call themselves Golden Girls. I wasn't
Golden
sure.
Girls.
I wasn't sure about the name at first. I wasn't sure if that was cool or not. But so the idea is you have a bunch of people over 65, often widows, and I hope no one's here from licensing. But I'm curious what will happen when the facilities licensing gets word of this and they go and inspect this place. What will happen? But you have, and I don't know where they are. I really haven't seen one or heard where they are. But it's the idea they're essentially having a nursing home, because more than 4 people is classified as a care home. So that's another option that's there, and then you never have to go into a publicly funded or private pay care home.
Hi. And Pat is next, asking, is the Interride being used to prioritize admission to long-term care?
Oh my gosh. I wish it was. So when we did our monitoring, I'm laughing because it's quite upsetting to me, this whole situation. It's very upsetting to me. So 6,500 people in BC are waiting for a long-term care bed as of last year. If I looked at the numbers now, we looked at them, I'm guessing they're higher. I'm assuming they're higher, especially with respiratory season. So, however, if you want to get into long-term care, all you do is you go to get whatever your Interri is, go to, and there might be somebody online who does this. This is your job, and you probably could correct me, but just simply go to the hospital and wait there for a long-term care bed. The average wait time in the hospital in BC for long-term care is 35 days. If you're a good Canadian and you wait your turn at home, it'll be 7.5 months on average. That's the average. Some people are waiting much longer, some people are shorter wait times, but because of not building enough long-term care beds in our province, that's the wait times are long. So are we using Interride? I believe we are using Interride to make sure you qualify for it, but I don't think we're really prioritizing unless it's a crisis and it's urgent and unreasonable safety issues are going on. We're doing this because we're rationing, as we do sometimes with healthcare. We have not built enough in the right places and not the right kinds of beds.
And then, yes, yes, there's lots of challenges with that.
Can I come back? I'm sorry. At every hour after 6, the this place turns down. I got to go turn off the alarm. I will be right back.
Okay. And as Dan comes back, if you want to add any additional questions, answer them in the chat. See, Jennifer shared the BC Seniors Advocate contact information. We have companion housing, Happy Pad in the chat as well. And there's lights, alarms. Yeah.
So can I want to finish. It's Dan. I'm just walking back. I
Yeah.
should just make sure I'm not leaving you up kind of depressed about long-term care or thinking I'm just telling all the problems, because this is difficult stuff. So what we're doing at the Seniors Advocate Office is we are doing, if I haven't already said this, we're doing a report, hopefully will come out by the summertime or before summertime, on long-term care supply and demand. We're specifically going to address 2 questions, because this is what I've heard, and I've heard it for too long. Have you heard it for too long too? We can't afford to build enough, and if we did build them, we can't staff them. Okay, so let's talk about the first one. How do we build them so they're more affordable? We're building some care homes right now that are well over $1 million. I've heard one. I'm in downtown Vancouver. I'll say one that's within 90 minutes of here is going to be $1.8 million a bed. I have an offer on a house in Victoria in a pretty nice area that's less than that much money. So like you can buy a whole house for that. It doesn't make sense to me that one, right? I think most people here would agree. I don't know what your house is worth, but well over a
Yeah,
million. You get the point. So we got to build
yes.
these things cheaper, and I don't mean seniors don't deserve the best, but it's too expensive, and we can build them more like a home than a hospital. The next thing is and different designs. The next piece is we got the next excuse we'll hear is, well, if we build them, we can't staff them. So we got to have a robust human resources plan that we'll work with unions, work with the post-secondary education, and we'll work with communities so that people want to work in the industry. So that's what this report's going to do. We can't solve all the problems, but we're going to basically say, here's some options, a continuum of seniors paying more that can afford to, and looking at what is the role of the private sector in private pay, okay, in privates. I'm not talking about the profit. We're not going to discuss that in this report. So I think there is a path forward that could reduce the wait list and do things like places like Chase or today I was hearing about Trail, making sure that there's care homes so people don't have to leave town for care.
That's great. And the report's coming out when? This year?
I keep on asking the staff the same question in the
Oh,
office,
yes. Okay.
but
Sometime soon. Check
it,
the
I hope it'll be in May or June.
to look for that. That will be good. I'll be looking for that too in our work we're doing. And we have from Dave, United Way Better at Home program in the Shoe Shop region is a big help to local seniors, especially widowers, residents over 65 years of age or 75 over 75 years. So that, yes, I'm sure you've connected with that as well, Dan, that I've heard that one as well. That's a impactful program.
It's a great program. I mean, essentially, what at some point in the past, before we had the program, the provincial government they got rid of funding the homemakers, and so we only had home care, and then there was a huge gap, and we realized people were moving into long-term care faster and sooner, or hospital or other places because things like cooking or those things that the Better Home does. So it's really a critical piece. And one of our challenges is we got to make sure we're paying the workers well enough, because sometimes I'll go to small communities and I'll hear that you can make more money cleaning a house directly than you can being a Better Home employee. So we need to make sure that we're treating employees well and paying them well. But it is a wonderful program. We need to see more funding for it and make sure the wait lists are not growing.
Excellent. And then we have from Sandra, thank you for your comments. I already live in a small manufactured home, not big enough for another person. Please send me the link you talked about.
Okay.
And so we can put the link in the chat as well. And then we have Kim, I appreciate the learnings today. And I think we're getting close to where we should stop potentially. It's just after 7. Is there any further questions? So now which chat? Well, I'm just remembering which link it was.
Am I allowed to say 2 more things? Very quickly? Okay. Here's a little thing you might want to try. Don't own your age. Be happy about who you are. So the first thing you can do is, I'll be really brief, is don't use the language or don't let that voice inside you tell you that you're not great. So you might hear people say things like senior moment. She looks good for her age. She's always looked good for her age. Can't teach an old dog new tricks. Those on the wrong side of 40, those kinds of things. Don't listen to that stuff. Okay. The other thing I just want to suggest is own your age. Be proud of who you are. Those anti-aging products that we buy, they might make you look younger. You might feel better about yourself, but they will not change your birth year. So own your age. Be proud of who you are. I'll start. My name's Dan. I was born in 1969. I'm proud of my wrinkles. I'm proud of my gray hair, and I invite you to do the same.
We all share. I'm proud of it as well. How about that? I want to share too. Excellent. I always enjoyed talking with Dan because he's has great advice and optimism and sharing, making changes, moving things forward. So, okay, so I'll move it to this closing session. Thank you very much so much, Dan, for coming today. Okay, Giselle also said enjoyed this so much. Thanks so much, Dan. So we want to thank everyone for attending today's webinar. We encourage you to attend other events scheduled for the Embrace Aging Month. Please visit our website, OkanaganEmbraceAging.com, for all the events and registration. We look forward to growing this event in the Okanagan and encourage anyone's interest in supporting Embrace Aging in the future to please contact us. Contact information is available on their website. You'll receive an email with a link to an online evaluation form to share your great evaluation for Dan. We will welcome everyone's feedback and suggestions for Embrace Aging events in the future, or any questions you'd like to hear. And we're getting lots of thank yous. I don't know if you see them,
Yeah.
Dan, but they are
Yes.
in here.
Thank you.
Thank you. That's great. Any closing parting words? Jaquetta is in charge of our webinar. I'll turn my mute off before my goodbye and thank you. Thanks. We'll talk to you later. Thanks so much, Dan.
Bye.
Bye.